Hey guys, I've got something that I wanted to explain for you. I was at the gym recently and I heard a client and a trainer having a conversation. The client was asking the trainer, why am I sore after I work out? And the trainer bumbled around. He didn't know the physiology behind it. He kept trying to jump around and tell her what to do about it. But she really just wanted to know why it was the case. So I thought I'd give you a little insight into that. There's a few things that happen. So I want to give you guys a little insight as to what is actually happening physiologically when you get sore after you work out. So, provided you're working out appropriately, you're overloading your muscles. So there is some sort of degradation of the muscle tissue that happens. So you picture an actual muscle cell gets some degree of damage. Hopefully it's not a whole lot, but some degree of damage. And there's a biochemical process that happens. A little bit of damage, you've got bradykinins, prostaglandins, you have potassium leaks out. So you have these substances that leak out of the cell and they're inflammatory. So part of the inflammatory process is the aggregation of cells or of chemicals that produce pain. Substance P, funny enough, substance P is one that produces pain. It actually potentiates your nociceptive fibers, the ones that deliver pain signals to your brain, just potentiates them to fire more easily. So that's one of the deals that's going on. Another one, you have metabolites that are produced during exercise that have an irritant effect to them as well. If they pool and they don't flush out quite as fast as they might in a less intense situation, they start to be irritating to the region, you feel some discomfort because of that. The inflammation piece of this is one of the more important factors. Inflammation is an important process in the body. It is a repair mechanism, one of the initial repair mechanisms, and so it's not the kind of thing you want to completely quench. Now we're talking about working out now, and we're not talking about chronic inflammation. Chronic inflammation, it would be useful for you to dampen that. But immediately post-workout, that inflammatory component is a stimulus for your body to repair. So if you want to maximize those gains, you want to let the inflammation happen for a number of hours. I would say next day, you can start doing some anti-inflammatory action, whether that's, you could take NSAIDs if that's your deal. My deal is not NSAIDs. My choice would be something more natural, such as fish oil, turmeric, ginger, cinnamon. If I were gonna take a supplement, I could take boswellia. Any of these things that are natural anti-inflammatories that have beneficial side effects rather than the deleterious side effects. But that's the deal with why do I hurt after I work out? You've got a degree of tissue damage that's actually occurred. So you have injured stuff, minor injury, but still some injury to tissues. And then you have a spill out of all these chemicals that are inflammatory. Part of that inflammatory process is the activation of pain. Hope that helps out and gives you some insight as to what to actually do post-workout if you're sore. Part two, so what do we do after the workout if we're sore? So one of the things we talked about, the inflammatory chemicals that are kind of hanging out in the area. They're not being flushed out quite as quickly as we might like. So motion. Motion is the first thing we should do. When you move the body, you extend and contract tissues, you pump fluids, you have the lymphatic fluids as well as the arteriovenous fluids that are being pumped as well with motion. And all that does is shuttle materials in, shuttle materials out. We're trying to shuttle out these waste materials, metabolites from the workout, the inflammatory chemicals that have drawn to the area. We're trying to flush those out of the area. So movement is one. Dietarily, one, make sure your diet is such that you can repair the tissues. You have the substrates available to repair the muscles that you're breaking down. So enough protein, right types of protein, make sure there's complete proteins and essential amino acids. And then the anti-inflammatory game. So anti-inflammatory game is lots of leafy greens, berries, nuts and seeds. You can kick out the grains, lots of spices, those anti-inflammatory spices we talked about, turmeric, ginger, cinnamon, mustard, cloves, there's a bunch of them. Use them liberally. You can take fish oil. 2 to 4 grams a day is a good dose for quelling inflammation. And then some manual techniques for the muscles to break up adhesions that might have formed, to manually flush out fluids, toxins, metabolites, all that stuff. So that's the stick. You can grab one of those roller sticks with the handles, grind out the tissues. in the direction of lymph flow would be beneficial. Lymph and venous flow goes toward the upper chest. You have venous flow going to the heart, you have lymphatic flow going to thoracic ducts. If you can foam roll, you're not that sore, but you're able to foam roll. But do some things that are physically manipulative to the tissues to get things moving inside and draw fluids back toward your collection ducts, the heart and the thoracic ducts. There's some to-dos. Hope that also helps in your planning for your recovery after workout. Thanks.